Hello, it's Dr. Rhonda Johnson. Today is Monday, May 23rd, 2022, and today I'm bringing my monkeypox update number 3. Well, to update as of Sunday, May 22nd, 2022, yesterday, the World Health Organization says there's 92 confirmed cases in 12 non-endemic countries with an additional 28 suspected cases under evaluation. So as of right now, this monkeypox outbreak is not a global pandemic, folks. It is a multi-country outbreak. Now here in the United States, we have 2 confirmed cases, one in Boston, one in New York City, and a third person in South Florida with a history of international travel is being treated as a presumptive case. And the CDC is monitoring 6 people who sat next to an infected traveler on an international flight. Now, since my last video on May 20th, the first genomic sequence of one of these Western cases was published by Portuguese scientists. The virus belongs to the West African monkeypox family, which causes a milder form of disease with a lower case fatality rate. Now, the good thing is virologists know this virus well, and monkeypox is not a new disease. We have tropical medicine specialists and doctors in West and Central Africa who have extensive clinical knowledge about monkeypox. We're not starting from zero, so that's a good thing. Now, infectious disease experts say monkeypox is not easily spread. It usually requires prolonged face-to-face contact with respiratory droplets or skin-to-skin contact with the lesions. The CDC does say there's a theoretical risk of airborne transmission. But in this era of COVID, I think it's reassuring to know that it's not as easily spread like COVID. Now, clinically, again, the incubation period is 1 to 2 weeks. Symptoms progress from fever, chills, headache. Some people may have a sore throat, muscle aches, and swollen lymph nodes are common. Then the rash comes out. The rash changes in appearance over about a week or so. It can be all over the body. It looks like a little pimple at first, then becomes a bigger pimple, and I'm simplifying this. And then it becomes full of pus, breaks open, and scabs. But what you have to remember is these lesions are highly contagious, and anything that comes in contact with them can be infectious. On the body, monkeypox lesions can look like chickenpox and shingles. In the genital areas, it can look like herpes and syphilis. But again, nobody expects the general public to self-diagnose themselves. If you think you have been exposed or if you're worried, do please contact a healthcare professional and let them know you have a suspicious rash. The CDC just issued a health alert to doctors and state health departments last week, so they know what to look out for. So in closing, this does not appear to be another COVID-like pandemic, at least as of today. From what I've read, maybe the situation will take a turn for the worse, but hopefully maybe basic public health measures such as education, prevention, contact tracing, isolation, vaccination of high exposure risk folks can shut this down. We will see. Time will tell. If you are worried in the meantime, put your mask on when you're out in public. Keep your hands clean. Avoid casual sex with multiple new partners, and evaluate your choice of international travel destinations. We are all just one plane flight away from a new virus anyway. Folks, you can't shut viruses out. They're ubiquitous, and they are very durable. They've lasted a long time in this world. That's my message today. As always, my views are my own. Stay safe and stay sane and have a great day.